How's it going, everyone? My name is Austin Young. This video is for my Care and Prevention of Athletic Injury course. This week we're looking at specifically shoulder injuries and how to rehabilitate and in the future prevent them. So this week we're going to be working through four different exercises that could be used for rehabilitation of a shoulder injury. So with a shoulder injury, it's usually due to a torn or strained ligament or muscle within the glenohumeral joint. These exercises are to strengthen the muscles in that joint and also to prevent inactive recovery. So in just a little bit, we're going to head over to the gym with my friend Luke. He's going to show us how to do these exercises. We're going to talk about how to set them up, and we're also going to talk about how to progress once we feel comfortable with those exercises. So let's head to the gym now and take a look at those exercises. So here we see Luke performing resisted shoulder flexion. To do this, simply set up a resistance band about waist height and flex your shoulder up against the resistance. What this is going to do is strengthen the deltoid muscle and the other muscles of the glenohumeral joint to promote an active recovery. Perform this for 3 to 5 sets of 10 to 15 reps. Right here, this is going to be the progression exercise, which is going to be dumbbell raises. Alright, so here Luke is performing the assisted or knee push-up rather. The key here is to focus on isometric flexion of the scapular muscles. What this is going to do is stabilize the scapula, and we could also see some shoulder flexion in this movement as well, so that's going to strengthen the deltoids a bit too. The progression exercises for this is just going to be a conventional push-up. Again, it's going to be 3 to 5 sets of 10 to 15 reps. And primarily, this is going to strengthen the trapezius, rhomboids, and serratus anterior muscles. So here Luke's performing just a conventional bicep curl, but he's really emphasizing on scapular stabilization. So through isometric flexion of the scapular stabilizers, he's again strengthening the shoulder joint here and helping out a bit. Here's just a tricep extension as well. These are all going to be sets of 3 to 5 sets, 10 to 15 reps, 3 times per week. Alright, so last exercise here, this is going to be resisted shoulder extension. What this does is strengthen the deltoids, the latissimus dorsi, both in the glenohumeral joints, promotes an active recovery, and also strengthen the muscles of those joints to prevent injury in the future. So again, 3 to 5 sets, 10 to 15 reps, 3 times per week. And the progression exercise is going to be the straight arm pull down, which is going to be shown here in just a second. Alright, so here's the straight arm pull down I mentioned just a second ago. Just a little bit more resistance on the lats and the delts here to strengthen the shoulder joint. Some common faults that you could be seeing in all of these exercises are simply focusing on the wrong muscle groups. So say for example in the bicep or tricep extension, the client's going to be focused on just the bicep, the triceps, as opposed to the isometric contraction of the trapezius, rhomboids, serratus anterior, or basically any of the muscles of the scapula, which is what they are intended for in this circumstance. Some also common faults could be seen is simply going for too much weight. What that's going to do is place too much strain on other muscles and potentially even create another shoulder injury. So other than that, short video this week, but those are some rehab and prevention exercises for shoulder injuries. Thanks for watching.